About 2 years ago, I was lying in bed with my wife. She said that she had just read that a 12-year-old boy had just jumped off a building on 86th Street. And I just sat there thinking, as the father of a 12-year-old child, whoa, like what was going through that boy's mind? Climbing those stairs, standing up on that roof. But it dawned on me more than ever that this is a disease. Whether it's curable or not, we want to be able to help.
I would describe mental illness as human,
real,
a process,
taxing, a challenge,
unpredictable.
During the past 3 years, we've focused on providing support and services for children and families where we offer programs in the schools and outside of the schools that help both parents and children and educators understand and become aware of the signs and symptoms of emerging or existing mental health challenges, substance use challenges and disorders.
This is our bulletin board with our staff, our support staff, so that the kids can put the names with the faces, and then this is the list. And then here is a poster that one of our student members made.
Has anyone asked you about peer-to-peer yet in any of your classes?
Peer-to-peer stands for peer-to-peer, so it's about raising awareness of depression and anxiety among the high school kids here at Rye High School.
What's really special about peer-to-peer in the high school is that it's a student-to-student led initiative. So it's really their work and their job to spread this awareness, erase this stigma, and follow the other two core focus points, which is to
promote help-seeking behavior and to recognize early signs and symptoms of mental health disorders.
Yeah, one of my friends met with the school psychologist and it really helped, so that's great.
I think peer-to-peer is so important for Rye Middle School because we need to reduce the stigma around mental health and make sure that everyone here has a sense of community and feels safe and welcomed.
At first my dad was just going to make me join a club, but I actually come to love it, and it's really fun to be part of a community and like to wear all like the cool sweatshirts and talk about like stuff that's like really important to me, because I know that I've struggled with mental health in the past.
So the peer-to-peer members meet with us once every 2 weeks after school. They want to promote visuals and messages about seeking help for mental health support, where they can get it, how they can get it, and who they can ask. The second day you say, and have you seen staff and students wearing these blue sweatshirts with this slogan? Let us tell you what that's about.
You can get help. Help helps. Get it? See what I did there? Mental wellness is really important. It is a big W to be mindful and understand your emotions. One word I would use to describe peer-to-peer is communicate.
Safety is helpful.
It's encouraging.
It's community.
Powerful.
all of our programs are based on social emotional learning, otherwise known as SEL. And SEL is really wonderful because it creates a sense of self-awareness. It promotes social awareness, responsible decision-making, and relationship skills, which are vital for kids to learn as they go out into the world.
Working with the Rye Youth Council enables us to bring invested community partners in, resources that we would not be able to acquire on our own, and have that consistent presence focused solely on the well-being and mental health of our kids.
We welcome them into our building. They provide supports when sometimes times are a little harder than we can manage all on our own. And then even when it's not, they've provided a good outlet for our students in many ways.
For a long time, the Rye Youth Council board and I really wanted to bring a clinician to Rye Youth Council because we understood the need to actually provide care in addition to creating awareness about mental health illness. And we were really fortunate because we received a generous 5-year gift from a local family, unfortunately, whose daughter died by suicide several years ago, and they wanted to make a change in our community.
Well, a loss like this is just devastating. But you don't give up because you have other children, you have a family, you have a life, and we know that Maddie wouldn't want that. After we established the Maddie Fund, what we really wanted is to have an impact on our community, Maddie's community, and the Rye Youth Council seemed to be a natural fit.
we were able to hire a licensed clinical social worker, a part-time licensed clinical social worker who's Linda Tillman, who is on our staff. And Linda was hired to start a clinical internship program so that we could offer clinical services to young people in our community. And within 8 months, Linda had Restore up and running.
It's important to talk to our youth about mental health challenges so they can understand what they may be going through. It's okay not to be okay, and to speak on your feelings so you can learn to go speaking to a trusted adult about what's been going on so we can actually come up with solutions to help them.
We've had more than 75 young people come into our offices, where I'm sitting right now, and receive one-on-one therapy with one of our clinicians. And that's something we're really proud of.
The Restore program helped my family when my son was going through a rough patch. The counselor was able to identify the issues that were facing my son and provide exercises and techniques that we could practice at home.
There's a whole wealth of information that people can share, which is what I think is great about some of these programs that are happening in the high school through the Rye Youth Council.
Athletics and mental health, to me, go hand in hand, and our students every day face challenges inside and outside of the classroom that carry on over to the field at some times. Our baseball and softball teams came together with experts from our Rye Youth Council to talk about mental health. It's not only just the idea of discussion, but tips and cues and supports for each other, which is huge.
One word I would use to describe the Rye Youth Council is helpful.
Empowering.
Valuable.
Amazing.
Committed to making a difference.
Remarkable.
Passionate.
Support.
Funding for the Rye Youth Council is so important because what they deliver for our kids and community costs money. It's not easy to bring professionals into the community, to bring training to the community and not charge for it.
One of the reasons that we are fundraising in our community is because we want to hire additional clinicians. We want to make it so every single time a family calls this office, we can say, yes, we have people available to help you.
So what brings me joy with the Rye Youth Council is hearing Lisa say to me at an event that a woman just came up to her and said, "You just saved my daughter's life."